And without wasting any more of his time, we really would like to welcome Dr.
Thank you. Thanks. Only one correction. My suggestion was to drop the doctor and leave Asher.
Okay, just
that would be much easier than trying to pronounce my name, which, by the way, is pronounced Ben-Arieh. And the translation to English is son of lion. So anyway, what I'm going to talk about today is basically, and I came here because in many aspects, and some of the meetings I already had this morning, I told about it, this indicator stuff for me in many aspects is not only an academic work, but it's more kind of a hobby. And when we started working on those indicator stuff, Larry Aber and me and some other people in the early 90s, we were, and I'm glad to say today, we were mocked at, we were attacked that we don't know what we are talking about, and how could we talk about beyond survival when so many kids are dying around the world. I still have, you know, this, I'm suppressing the name, but I still have a very traumatic memory from the World Bank Conference in '96 when I presented it for the first time in a big audience, and the World Bank operates in a way that you don't present your own papers, but there is a discussant to present your paper, and the discussant who was presenting my paper was an economist professor from American University in DC. I really suppressed her name, and it was basically attacking me that how could I talk about infant mortality rate as non-relevant or not relevant enough for policy purposes when so many kids are dying and so many differences are, and so on and so forth. And now today we really see a kind of maturing and a kind of acceptance in the field, and people around the world are realizing that there is probably some merit to the fact that we need not to substitute the old indicators or the old measures with new ones, but we need to add to the old measures some new ones measures. So and like from, you know, beyond survival, we are talking now more about survival and beyond, and not the shift from survival to beyond and many other things. So what I basically want to do today is to very briefly talk about the history of child indicators movement, because I don't think that's the most important thing, but then you could not talk about the developments and what's happening in the field without understanding how it started and where its roots is. And then I would like to outline 9 shifts or changes that I think or I see that occurred in the field or are still occurring in the field, and then I will try to explain what led to those shifts. What are the 3 main components that moved the field or made those 9 shifts possible, and then I will do what usually people warn me not to do, because then I could be held accountable for it, but I will try to talk with you where I think the field is going in the future. I'll try to anticipate how the field of child indicators would look in a couple of years, and hopefully I won't be wrong, but we'll never know. So, first of all, the use of statistical data or indicator to measure, monitor children's well-being is definitely not a new thing. It's not something that anybody invented in the last 20 or 50 years. In one of my studies where I was looking for state of the child reports from all over the world, I have a collection of state of the child reports from all over the world in my office in Jerusalem. The first one I found was from the territory of Alaska in 1940. So somebody in Alaska published a statistical report on the status of Alaskan children in the early 40s, and then there was another one published by the Citizen Committee for Children in New York. Alfred J. Kahn, or the late Alfred J. Kahn, was the academic advisor for that report in 1945, if you remember right. And since then, we saw sporadic state of the child reports published everywhere. Theoretically or academically, I think most of the people in the field would agree that the origins of the current child indicators movement is probably in the 60s, in the social indicators movement, the very famous influential book of Bauer, that used for the first time the term social indicators, and in a period that I was very young those days, and definitely not even in high school, I think, but an era or a decade where people thought that all we need to do is really to collect good data and publish it, and then there would become good policies and the problems would be solved. And under that assumption, people were really involved in collecting more data and trying to promote the well-being of various population groups, and among them also children. Now, it's true that this child indicator movement was based on those earlier efforts, but in many aspects it really sprang into life only in the last 25 or 30 years. And there's a number of events that contributed to this dramatic rise. And in one of my studies, I've shown we've done a literature review, looked for state of the child reports from all over the world, and what we found that in 4 years, between the year 2000 to 2004, we found, meaning state of child reports only in English or Hebrew, or at least have statistical, or at least have abstracts in English, but we found twice as much reports than what was published in the old decade of the 80s. So there is evidence to a dramatic sprung, and everybody is publishing state of the child reports or various reports on status of children in own level. And it started basically in many aspects. It started when UNICEF started publishing the state of the world children in 1979, and the fact that UNICEF is publishing it on an annual basis since then. And then in the late 80s, the European project, which I'll come back to it a lot, and it's a sociological project, and they were the first one to term childhood as a sociological construct, and to talk about childhood as a phase of itself and not only a preparation for adulthood. And they finished their project and published for the first time some of their thoughts and findings in the late 80s, 89, 90. And then Kids Count in the United States started in 5 states in 1990, and as of 1994 is in 50 states, and many other local and national initiatives that sprang basically sometime in the early 90s, late 80s, and the field really developed. Now, child indicators, or when we talk about indicators at large, we basically talk about measures, statistical data that is used to describe the condition of children and to monitor or track child outcomes or to set goals. Now, I've written a lot, and other people have written also about the notable gaps and inadequacies in existing child well-being indicators. But on the other hand, there is basically an endless array of data series and databases and lots of data that is floating around. And the interesting thing is that there is a paradox. On the one hand, there's lots of data and much more data collected, much more administrative data available, and I'll come back to it and talk about the role of administrative data in the development of child indicators. But on the other hand, there are still those stubborn people like me and others that are standing before you and before other audiences and says, we don't have enough data, or we don't have the data that we want. So there is a paradox here, and we need to acknowledge it. Now, some of the data, or some of the development of the data is really because there was this movement toward accountability policies and changes in the family life and many other aspects that really supported. But I'm arguing, and I'll come back to it after I'll describe the shifts, that there are basically three bases for this rapid development of the child indicators movement. The first one is what I call the new demands. And there is a new demand, especially in regard to the policy utility of indicators, and the call from policymakers, bring us different numbers, or bring them in different patterns or different ways so we could use them. And don't just send us those huge tables with endless numbers that we don't know what to do with, and that contributed a lot to the development of the movement. The second is the methodological advancement, and I'll come back to it later on and talk about it. One is the administrative data, the other is the child as the unit of observation, and other things we'll talk about. And then there is also the new normative and conceptual theories that sprang, and I'll talk about three of them. One is the children's right normative concept, and in Canada it's easier to talk about it than in the United States. And the second is really the sociological or sociology of childhood, or the new sociology of childhood. And the third one is the ecological developmental theory of Yuri Bronfenbrenner. Now, this evolution of child well-being indicators, in my eyes, have occurred virtually everywhere, but at varying paces. So those shifts are happening everywhere. And I'll describe them in a moment, because that's the major part of my talk, but in different paces. And the fact that in some countries or in some regions they are occurring slower doesn't mean they are not occurring. And I would argue, as I said before, that the current status can be best understood in regard to 9 major shifts, and I'll start from the first one. The first shift, again, that